Dr. Alicia here. Join us to listen to one of our Q&A lives that we did on Instagram. It's all about the most common first trimester questions that we get, from can I dye my hair in pregnancy all the way through to I am feeling like crap, when will this end? So we go through the most common questions that we get, and they happen so often that we really took some time to make sure that we answered them in detail. So I hope you guys enjoy this, and don't forget that we have a newly pregnant checklist that you guys can download, and we'll make sure it's linked in the show notes below.
Welcome to the She Found Motherhood podcast. We are doctors Sarah and Alicia, maternity physicians and moms who have been through it all. We want to empower you with knowledge so you can have the best pregnancy, birth, and postpartum experience you can.
She Found Health and She Found Motherhood is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This information does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or another qualified health provider with any questions you may have regarding a medical condition. The views expressed by She Found Health and She Found Motherhood and our guests are not representative of any of the institutions with which we are affiliated. Some of our podcast episodes are sponsored so that we can keep getting great info out there to you, our listeners. We only partner with companies that we truly believe in. Some of our links and suggestions may be affiliates, and we would appreciate you using them to help fund this important work. Now let's get to it.
Hi, everybody. We're 1 minute early. Look at that. I didn't know.
Gosh.
I didn't think it would connect that quickly. So I'm Dr. Sarah. This is Dr. Alicia. And we are here live to do our first trimester Q&A. So we asked some questions yesterday just to get a little bit of info. But if you do have questions, please feel free to throw them into the chat.
So why don't we get started? First of all, for those of you who don't know us, we are maternity docs in Victoria, BC, Canada, and we provide high quality information to help empower people in their journey from pregnancy through to parenthood. So everything from the beginning of a fertility or trying to get pregnant all the way through pregnancy and the postpartum is what we specialize in and we really love to do. So we're going to focus a bit on the first trimester, first half of pregnancy today, and we got some questions. So we're going to go through those, and hopefully they are helpful to you guys following. The first one, and this is one that we often get, is around kind of beauty products in pregnancy or trying to conceive. And when I say beauty products, I mean like, can I dye my hair? Can I get a manicure? Can I get a facial? And the answer is, generally speaking, yes. There's a few things that we avoid in pregnancy, but generally speaking, as long as you're in a well-ventilated area when you're getting these things done, it's totally fine to get your hair dyed, to get gel nails done. Now, I know for some people, I've never had what's it called? They do
yeah.
artificial
Like
nails and you
gel.
got to bzz them off.
Oh, I've had that done.
Yeah. So
Yeah,
maybe
love
wear a mask when that's happening to you, just so you don't inhale any of those particles. I can't imagine it would cause any trouble, but if you want to be super safe, that's fine.
Probably just in general good.
Yeah, just in general good.
practice, even when you're not pregnant.
Yeah, sure. But certainly no problem doing manicures, pedicures, facials, hair coloring treatments, anything like that. A few things that we do suggest to avoid, some of them because we don't really know and we're a bit overly cautious in pregnancy, is laser hair removal. We generally say avoid that in pregnancy. And your hair grows so differently in pregnancy. Just wait till you're done and you've had your baby and then have at her. The other thing that we generally avoid is using any topical or oral vitamin A products. So this is like your retinoic acid or your Retin A or your Accutane. And the reason that we avoid that is because the oral form can cause issues with baby's development. And the topical, it's probably fine. But again, we're somewhat overly cautious. So we generally avoid those in pregnancy.
Yeah. And I was just going to share that I did a podcast with Dr. Breed Budlowski, who does medical aesthetics and is a board certified emergency physician and has now transitioned to full-time medical aesthetics. And we talk all about skincare and pregnancy and breastfeeding. So we'll share that when we're done the live here, because most of the questions that we get commonly are touched on in that.
Yeah. And then you guys talked a little bit about Botox is the other question. And again, we say overly cautious, probably there's no real evidence, but probably best to avoid Botox when you're pregnant. And again, probably okay to start when you're postpartum and even if you're breastfeeding. But have a listen to that podcast because like Sarah said, they went over all of the details about all of these types of things. We have a little bit about tooth filling in second trimester. Now, here's the thing about dental procedures. If you need to get it done, you need to get it done. If you don't need to get it done, wait till after you're done being pregnant. So in that postpartum period. Again, the evidence isn't great one way or the other, but we're abundantly cautious. But if you have a filling, you've had a cavity, it's causing pain, it's getting worse, and you need to get it filled, please go ahead. And generally speaking, for procedures in pregnancy, the second trimester is the safest time to do them. So if you need a semi-urgent surgery, if you need dental work done, if you need a lump removed and local anesthetic, technically it's probably fine at any point, but the second trimester is the safest time to get any of those elective type of procedures done that can't wait until you're done being pregnant. Another question about carrot juice and vitamin A. I feel like you would have to drink a
Oh, wow.
lot,
That's what I feel like
a
too.
lot of carrot juice
Mhm.
to get
Yeah.
anything in the realm of dangerous from vitamin A. And I haven't looked into the data on that, but I feel like you would be having a lovely orange complexion
Yes.
before you
Oh,
got
yeah.
vitamin A
Yeah.
overdose
Yeah.
from carrot juice.
Yeah.
Yeah.
So
Yeah.
everything in moderation.
Everything in moderation, correct. So the next question that we often get is how much
Cramping.
cramping? Sarah's trying to read my writing.
Yeah.
I wrote them on a post-it note. She can't read it.
Yeah. Okay. So I will share that with my first pregnancy, I was very put off by the cramping that I was experiencing because I didn't know that it was a normal part of pregnancy. But if you think about it, your uterus is growing from like the size of a fist to eventually the size of a watermelon. So it is totally normal for you to experience intermittent cramping during first trimester. How much is normal? It depends. There's no set normal amount. I would say, and Alicia can pipe in, but I would say, generally speaking, mild cramping, that's mild menstrual cramps, that comes and goes, would not be concerning. But if you're having regular painful cramping, or it's associated with bleeding, or it is localized to one specific side or the other, so if it's in the right lower part of your belly or the left lower part of your belly only, then that would be worrisome. I always don't hesitate to call your care provider. If you're having cramping for the first time and you're not sure if it's normal, reach out. But generally speaking, it's normal to have mild to moderate cramping on and off throughout that first trimester.
Yeah, the key, I think, is it consistent and is it ongoing despite resting? Is it causing you distress? And is it associated with other issues? So if you have a cramping and fever,
Yeah.
or if you have a cramping and bleeding, or if you have cramping that's not improving over hours despite some Tylenol and rest and hydration, then that's when you'd really want to check in with your care provider. But some cramping here and there, off and on, over a period of time can be very normal and very typical of that growing uterus and stretching ligaments and all of those pieces of the puzzle that change in those kind of first few weeks to months of pregnancy.
Another question. Oh, we got this question. Sorry, do you like my squinching, reading your handwriting? That we get all the time is I want to get pregnant, but I'm breastfeeding and I don't have a period. They could be like me and get pregnant regardless. But that's not very common. It's not super common for folks to get pregnant while they're breastfeeding and amenorrheic, meaning not having a period, but it can happen because you ovulate before you have your first bleed. But if you're actively trying to conceive and you haven't had your period back yet, then we're going to have to look at weaning the breastfeeding. So meaning spacing of the feeds and shortening the duration. And there's no set number or recipe. Generally speaking, once you're going longer than 3 hours between feeds, it's possible for your period to come back, but it's so different for everyone.
Yeah. And so, how we know you're ovulating regularly, and a lot of people trying to get pregnant are like, am I ovulating or not? So, if you're having a regularly spaced period, like every 23 to 35 days is the range of normal, but it's consistent, then the chances are you are ovulating. Most people ovulate day 14 ish, day one being the first day of your period. So, approximately 14-ish days after that. If you're having irregular periods, like you have one, then 3 months later you have one, then 2 weeks later you have one, chances are you're not actually ovulating. And if you're not ovulating, you can't get pregnant. Now, every once in a while within that, you can ovulate. So you just may not be ovulating regularly. So just because you're having irregular periods doesn't mean that you can't get pregnant. But it's less likely if you're trying to get pregnant that you're going to get pregnant in a quick way. Some people breastfeeding ovulate at 6 weeks despite exclusive breastfeeding. Her too, probably. But some people do not start ovulating until they have stopped completely breastfeeding. And we don't really know why. I think some people are just more sensitive to certain hormones that are released while we're breastfeeding than other people. So I've certainly had people who are still breastfeeding 18 months later, just like morning and night, and they still haven't started ovulating and they have to completely stop to start ovulating. So everybody is very different, and the reactions to how much you're feeding or not is not necessarily consistent. But most people, once their child starts taking solids and demanding less of the breast, then most people will start ovulating and getting their periods back. And again, if you had regular, normal cyclical periods before pregnancy, you should probably get back to that. If you had irregular periods before, you're probably going to have irregular periods after as well.
Is this pain I'm feeling in my pelvis normal? Should I do genetic testing for chromosomal differences in my baby? Is it safe to go to the dentist while I'm pregnant? Doctors and maternity specialists Sarah and Alicia are here to empower you with even more knowledge so you can have the best pregnancy, birth, and postpartum experience you can. Presenting the Pregnancy to Parenthood podcast, a new series of informative episodes geared week by week toward whatever trimester of pregnancy you're in. Tune in weekly, following along relevant topics as you move through pregnancy, or just binge listen and come back to the episodes you found most helpful. Access the full series for a full 2 years and listen to it on your own time. To learn more, go to www.shefoundhealth.ca or click the link below.
The next question that we got, which is a great question, is supplements in pregnancy.
Oh, I'm just showing we have
Okay.
another question we'll come back to in the chat in case
Yeah.
it moves away.
So supplements other than a prenatal vitamin. So it's a tricky one. It depends on where you live, but we're going to base it based on Victoria, BC.
And all of Canada.
Of all of Canada, all of the northern and super southern hemispheres that are relatively far away from the equator. In fact, we don't get enough sunshine. So we should all be on, including our babies, a supplement of vitamin D. So for infants, I know me neither. Infants, it's about 400 international units a day, and you can get those in the little vitamin D drops, and those are the most convenient, not the 1 milliliter things, just the single drops. You can put on your nipple or in a bottle. It's easy peasy. Lemon squeezy, as my kids say. They don't. Actually, that's just me. That's that.
Yeah.
So vitamin D. And for kids, children, it's 800 international units. And for adults, it's at least 1,000 international units. So in pregnancy, you should be doing the same thing. The other thing that's shown some evidence for brain development is the omega-369s. So you should be doing that. A good source of that is those oily fishes like a mackerel or a salmon. So if you're eating that a couple of times a week, you're probably getting it. And if not, you can feel free to take a supplement. Now, if you're feeling pretty gross, like some of you in the first trimester,
Don't worry.
might be a bit challenging. So you just do the best you can. And then a prenatal vitamin, a good prenatal vitamin, making sure that you have enough folic acid in it is the big thing. So that's around the prenatal supplements. Anything else that you would add in terms of prenatal supplements?
No, I would just add that I think it's really important is that every situation is unique, and it's not necessarily just saying take a prenatal vitamin and you'll be fine. It really depends on what your general diet is. And so it's important to know that if you have unique questions related pertaining to yourself, you can connect with your care provider or with a prenatal a nutritionist who has specific interest and expertise in prenatal nutrition. And so we have a few folks that we have met through social media. And so prenatal dietitian. She's based out of New Brunswick. The prenatal nutritionist, I believe she's down in California, are the two that we've connected with a lot, as well as Noelle from Nourished Beginnings Pregnancy. So they have a lot of resources. Nutrition is a really unique expertise that we have like a very basic understanding. And so we can tell you the general recommendations for the average population, but if you have a specific diet that you follow or unique, needs in terms of medical complexities, definitely connect with someone who's got subspecialized training in that area.
Yeah, for sure. And a lot of extended benefits will cover it. So if you've got extended benefits, use them. Get some extra advice. It's great. So one of my favorite questions, not for the poor person who asked it, was I feel like crap.
Yeah.
I'm 10 weeks and I feel like crap. I can barely get out of bed. Is this going to get better? And the answer is generally speaking, yes. The first trimester is so challenging. Your body is changing hugely. There's so much going on. You have this huge amount of progesterone going on to really help support that first trimester, which causes all kinds of slowing down of our gastrointestinal tract. So we often get nauseous and bloated and constipated and feel like, and then we have those big hormones, which are causing us to feel nauseous and having vomiting as well. And then we're just exhausted. You're starting to grow a human being and so fatigued that a lot of people just don't have any energy. And what do we suggest to people who are struggling with that?
So we suggest that you listen to what your body needs and rest. So we'll write notes to cut down on your work and just to listen to what your body needs. So sleep is medicine. Sleep will help your fatigue. It'll also help the nausea. Oftentimes, just eat what tastes good to you. A lot of folks are very concerned that they have to have like appropriate nutritional intake. And yes, you do, but like over the span of a week, right? Like I could not eat salad greens for the life of me while I was pregnant. And the first trimester, particularly, all I wanted was like fried food and nachos. don't worry, just eat what you can keep down, right? We have a whole podcast all about our very first podcast episode, number 1. It's all about nausea and vomiting in pregnancy and making sure you have a listen to that and take some of those tips. And then just being kind. It will get better one day at a time. What else do you have to add?
Yeah, we also did a podcast with Noelle from Nourished Beginnings
Yes. Oh, that's such a
on
good
kind of
one.
trimester symptoms and foods that can help, because
Yeah.
there are things that are sour can really help that nausea and that feeling of kind of morning sickness, like green apples, green grapes, putting some citrus in your water. So there's some great tips in there. And she talks about some of the more other common issues that kind of come up in first trimester and how to manage your diet. Another one that kind of I keep forgetting about is when our blood sugar comes
Yes.
down, when it spikes and comes down, we often feel gross. We feel nauseous. And so pairing a protein with your carbohydrate, so like peanut butter and crackers or cheese and an apple, can really help regulate your blood sugars and stop those big dips and dives that can often make us feel a bit nauseous. However, having those carbs often help people just having something in their stomach. So trying to pair a protein with the carb if you're needing to eat those kind of crackers or whatever to make you feel a little bit better. Certainly adding on a protein. The other thing is that citrus, so that sour can be really helpful. So like we said, green apples and grapes, citrus in your water, but having a lemon lozenge or gravel makes this organic ginger lozenge. And so that can be helpful as well. Just sucking on something often can help with that nausea as well. So yes, first trimester can feel pretty crummy for some people, not for everybody. And yes, the vast majority of times it does improve once you get into that kind of second trimester, which is usually around 12 or 13 weeks. Most people start to get their energy back. They start to have less nausea. They start to be able to get back into exercising if that's what they want to do. But certainly in that first trimester, just be kind to yourself. It's only a short period in the grand scheme of things. So rest if you need to. Make sure you're getting some reasonable nutrition, but don't worry too much about it. And the other tip that we have is if you are feeling nauseous, those prenatal vitamins can often make you feel worse. So the most important thing is the folic acid. So take a little folic acid. And if you want to take a kid's chewable, that's great, because as you'll remember, we don't want too much vitamin A, and there's a bit too much vitamin A in the regular adult multivitamin. So that's why kids chewable and some folic acid, and that should get you through until kind of second trimester. And then you can go back to your prenatal vitamins if you're feeling up to it.
And just know that if you don't feel terrible, that's okay too. A lot of people are really worried. They're like, I feel great. Is there something wrong? Probably not.
I felt totally fine. And the only time I felt nauseous was when I was working next to my colleague who was having horrible morning sickness. She was just trying to get through her day seeing patients. And I just had this like sympathy nausea for a minute or two when I was working next to her and saw her retching her grapes that she was trying to keep down before seeing a patient. Otherwise, I felt great first trimester. And both my pregnancies were totally fine.
Yeah. So all good. If you feel great, good on you.
Yeah.
I wanted to get back to a question that was asked in the chat that we missed in the first part. And that was, I believe it was around pregnancy spacing. What's safest for mom and baby? And we have a whole podcast. We definitely have a YouTube video about this.
Something about it. YouTube.
Yeah, we'll share it. So generally speaking, the recommendation is 18 months is the safest. And that is from birth to birth, correct?
18 months to 5 years. That's
Correct.
the spacing.
Yeah.
So more than 18 months, less than 5 years.
Yeah.
Yeah.
And the reason being is it takes a long time for us to recover from pregnancy. So giving your body that space and time to build back up your iron stores and for your ligaments and all the complex pelvic structures to somewhat go back to the new normal, I would say. In terms of baby, generally speaking, the safety is more pertaining to the mom, but there are increased risks, I believe, and you can correct me on this. It's things like preeclampsia, et cetera, can be a little bit higher if you're within those less than 18 months or beyond 5 years. But I share my story loud and proud as a cautionary, but also normalizing tale is that I got pregnant 4 months postpartum after my first with my second while I was exclusively breastfeeding and not having a period. And my pregnancy was completely uncomplicated and fine. The birth was not so uncomplicated, but that had nothing to do with the spacing and more to do with my darling little baby's position.
Yes.
Generally speaking, if you do unintendedly get pregnant in that shorter window, the biggest concern would be if you had a cesarean birth, an operative birth, because we want that scar to heal. But for most folks, if you can wait, better for your body. If you don't wait, don't worry, we'll support you through it. And I'll defer to Alicia for further comments.
No, that's all. I just wanted to say big ol' hi to Mama Psychologists who are on. And if you guys have not seen their book, it is incredible. Their postpartum workbook. So if you have any friends who are pregnant, go buy it for them. It's incredible workbook for kind of that postpartum period. And if you were on our email list, we sent out an email last week about it.
With the link.
With the link. It's on our Amazon page as well. If you're not on our email list, head on over to our website and sign up, because we send out like our favorite kind of books and tips and learning issues and all that type of stuff.
Spacing between first and second for the 5 years. Yes, any pregnancy spacing. So if I had my first 7 years ago and now I'm having my second pregnancy 7 years later, yes. And then if I go on to have another 5 years, yes. So it's anything between 18 months and 5 years is the safest. And yeah, it's interesting. Like our bodies, there's so much we don't know.
I don't think it's a huge risk, though, to be honest.
No.
Yeah. So it's not a big deal. But yeah. Any other questions, guys? We've got covered. I think there was a lot of similar questions that came through. So we covered most of those. But if there's no other questions, we can certainly hop off. But we've got tons of podcasts all about kind of both trying to conceive and that first trimester and some of the common symptoms that can come up during that. And then we also have a week-by-week podcast called the Pregnancy to Parenthood Podcast. It's very low cost, and it almost walks you through pregnancy from conception all the way through the 4th trimester in terms of supporting mom and baby postpartum and the birth or postpartum, what to expect, but also goes through a lot of the investigations that are typically ordered, what we look at the 20-week ultrasound, and what can be some of the issues that can come up. We go through that, and we've got lots of great guests on our podcast as well. There's a few of our regular podcasts that we've pulled into there because they're so great, but most of them are all new content. Be sure to check out if you're wanting just a little bit more information on a week-by-week basis. Certainly check out our podcast around that.
Yeah. Thanks for joining us today, everybody.
Have a great day. Thanks for listening. Make sure to check out our website at www.shefoundhealth.ca and to sign up for our community for weekly bump blasts. Make sure to check us out on Instagram or Facebook at she.found.motherhood and head on over to your favorite podcast app and leave a review and a 5-star rating. If you enjoyed this podcast, take a pic of yourself listening to it and share it on social. Make sure to tag us on it so we know to keep making them.